Welcome to today's webinar, Fatigue in the Workplace. During today's presentation, attendees will be in a listen-only mode. To ensure that you can see all of the content for the event, please maximize your event window. To also maximize your slide view, click on the Scale button located in the upper right area of the window above the slides so that it shows as 100%. If during the program you would like to submit a question, please use the chat pod located in the lower left-hand corner of your screen. Type your question in the box at the bottom and click Send. If you have any technical difficulties, you may contact the Help Desk at 877-297-2901. And now I'm going to turn it over to Emily. Please go ahead.
Thank you. Hello everyone, and thank you for joining us here today to talk about fatigue in the workplace and our survey series. My name is Emily Whitcomb, and I am the Senior Program Manager on our Fatigue Initiative here at the National Safety Council. If you are not familiar with the National Safety Council, we are a 100-year-old nonprofit that works to eliminate preventable deaths at work, in homes and communities, and on the road through leadership, research, education, and advocacy. We launched our Fatigue Initiative a little over 2 years ago. It was July of 2016, and we are really focused on educating employers and providing resources to managing fatigue as well as drowsy driving in our workplaces. So let's look at our agenda for today. First I'm going to talk a bit about fatigue as an impairment in the workplace and on the roads, and then share a bit about our survey series, give you some methodology and why we decided to do this survey series. I will share some high-level findings from all three of our reports. And as you may be aware, today we released the third and final report in this series, Fatigue and Safety Critical Industries, which I'll go into more detail about. And then we will wrap it up by sharing some resources and an upcoming event that we have. And then we should have some time for Q&A at the end. So let's start by talking about fatigue as an impairment. So I'm often asked, what is fatigue? And fatigue describes the feelings of tiredness, sleepiness, reduced energy, and increased effort needed to perform tasks at a desired level. So in the workplace, this could look like decreased productivity, sluggish behavior, maybe yawning or having trouble focusing. So we've all felt fatigue. We all know what it feels like to be tired at the end of the day. We all know what it feels like to be sleepy or have some reduced energy. No one is immune to fatigue. It's just one of those human factors. And because no one is immune to it, and because it's one of those human factors, it presents itself in just about every workplace. And so that's really why we're here, to educate employers about fatigue as an impairment. So fatigue is an impairment that affects our ability to think. It impairs our attention, our memory, our concentration, our vigilance, our impulse control, and these are just a few. Really that list goes on and on and on and on. But when you're tired, you just don't think as clearly or as well as you would if you were fully rested or alert and awake. Because we aren't thinking clearly, we see major performance impairments in tired individuals. So at work, this could look like decreased productivity or increased likelihood to make mistakes or errors. And on the road, it means poor driving skills. Our performance is actually impaired so much that people compare being tired to being drunk. So sleep loss mimics alcohol intoxication, and this was a study that was done a few years ago. A person who loses 2 hours of sleep performs similarly to someone who drinks 3 beers. And because of that, a tired employee can be nearly as dangerous as an intoxicated employee. Studies have shown sleep problems reduce a worker's productivity by up to 6%. So for someone who gets less than 7 hours of sleep a night, they lose almost 4 days a year in presenteeism. That's where they're present at work, but they're not necessarily as productive as they would be if they had a full night's rest. But for somebody with an untreated sleep disorder, for example, untreated insomnia, they could expect to lose about 11 days a year in presenteeism, meaning they're present at work but not as productive as they would be if they were getting a good rest. But most importantly, fatigue is an impairment that affects our ability to be safe. In 2014, a meta-analysis was conducted, and that's where they gather a bunch of different studies together on a topic, and they found that 13% of workplace injuries could be attributed to sleep problems. So another study here for you. This study looked at hours of sleep workers get and their rate of injury. And as you can see, those who get less sleep, I'll use my pointer here, those who get less sleep have a higher rate of injury on the job, as opposed to those who are getting longer hours of sleep have a lower rate. So really the take home here is that the more sleep a worker gets, the less likely they are to get hurt on the job. And similarly, this study looks at shift duration and risk of injury. And as you can see, once you get beyond 8 hours on the job, your risk of injury really just starts to climb. So there's really no shortage of research that shows fatigue increases risk of accident or injury in the workplace. There's decades of research that's really correlating. So we were interested in just how widespread fatigue is in the workplace. And that was really the impetus for our survey series that we're here to talk about today. So in 2017, we conducted 2 national surveys, and we're releasing it in these 3-part series of reports. So I'll go a bit through the methodology here with you. So the surveys we conducted last year in 2017, we're releasing in the 3 reports you can see up here. If you're interested in downloading those reports, you can find them at nsc.org/fatigue survey. So the surveys and the corresponding reports really dug into the prevalence of fatigue risk factors in the workplace and safety critical incidents that people are experiencing that are caused by fatigue that are occurring in the workplace. So I'll share some of the methodology with you. In 2017, we conducted 2 surveys. The first was a probability-based survey of 2010 working Americans, looking at their prevalence of fatigue risk factors and if those working Americans have ever experienced fatigue-related incidents in the workplace. The second survey we conducted was of 504 HR decision makers who are responsible for either the health, safety, or the shift scheduling at their work site. And we asked them about risk factors for fatigue in their operations and if their workplace had ever experienced any fatigue-related incidents. So data from those 2 surveys have been released in this 3-part series of reports that we're going to talk about today. So the first report in that series is Fatigue in the Workplace, Causes and Consequences of Employee Fatigue. And this first report really dug into that, the survey of the working Americans, or here forward we tend to call it the employee survey. So it was looking at those 2010 employees about their risk factors and safety critical incidents. The second report in that survey releases the findings from the employer survey, those 504 HR decision makers who reported out on operational risk factors that they have in their worksite and if they've ever had any safety critical incidents related to tired employees in their worksite. And the third and final report in that series that we released today is called Fatigue and Safety Critical Industries, Impact, Risks, and Recommendations. And so what we did is we took the results of both the employee and employer survey, and we actually dissected it by transportation, utility, manufacturing, and construction to get an industry by industry comparison of what's happening regarding fatigue risk factors in the workplace and safety critical incidents. But the other exciting piece of this survey is that we did an analysis of employee responses versus employer responses, which is really kind of an interesting perspective. So we're going to start off by looking at the first survey in our series, and that is the Causes and Consequences of Employee Fatigue. And this again is the survey and the report that looks at the data from those 2010 working Americans, where we asked them about their risk factors for fatigue and any safety critical incidents they've experienced in the workplace. So the report really kicks off here by looking at the 9 risk factors for fatigue that we asked survey respondents about. If you have your report with you and you're following along, you can find these risk factors on page 4 of that report. So we asked about shift work, if they work during high-risk hours such as at night or in the early morning, if they have a physically or mentally demanding job, if they work long shifts, if they work long weeks, if they're getting enough sleep, if they're getting rest breaks during their shifts, if they have quick shift returns, which refers to the amount of time you have off between your shifts, and if they have long commutes. So this is not an exhaustive list of fatigue risk factors. It was just some of the risk factors we were really interested in digging into. But one of the big takeaways we had from this survey was just how prevalent these risk factors were. So in the 2010 working Americans that we surveyed, we found that 97% of them reported at least one risk factor for fatigue. And this honestly was very surprising to us. We realized that fatigue was prevalent, but we didn't realize just how prevalent these risk factors would be. But even more surprising, 80% of those we surveyed had more than one risk factor for fatigue. So we obviously know that this is a problem that our employees are really feeling. So let's take a second to dig into a few of these risk factors. One of the most important ones here is sleep. If you don't get enough sleep, you're obviously going to be tired and fatigued. We found that 43% of those employees that we surveyed were not getting at least 7 hours of sleep a day. So that's really almost half of our workforce that's working with some level of sleep deprivation. And so this is obviously concerning to us here. But I also wanted to point out our night shift workers are often more affected by sleep loss than any other shift. We found that 59% of our night shift workers were sleeping less than 7 hours versus 45% of our day shift workers. So there's lots of research out there that has shown our night shift workers aren't getting enough sleep, but we found that in our survey as well. So in addition to looking at risk factors for fatigue, we also asked about safety critical incidents or any sort of consequences they have experienced due to being tired. And so on page 14 of that first report, we broke them down into 3 different levels of consequences, with the first being decreased cognitive performance. Are they having trouble thinking clearly on the job because they're tired? And we found that 97% of the participants in our survey reported some sort of decreased cognitive performance. And if you're interested in what those were, we have them outlined in the report so you can get some more information on that. We asked about microsleeps, which really just refers to unintentionally kind of nodding off or falling asleep, even if it's for just a few seconds. But as we know, if you're doing a safety critical task, falling asleep is not a good thing. We found that 47% of our survey respondents reported experiencing a microsleep in the past year, and I'll give you a little more details about that on the next slide. And then we asked if employees have ever experienced a safety critical incident due to fatigue, and we found that 16% of those 2010 working Americans that we surveyed reported at least one safety incident due to fatigue. So digging into those microsleeps, we found that 27% of those working Americans that we surveyed reported falling asleep unintentionally on the job in the past month. So that's a little over a quarter of our workforce that's falling asleep on the job. This is very concerning for us, especially if we have workers on safety-sensitive tasks. We asked if they've ever in the past month fallen asleep on the road. We found that 16% of our working Americans have fallen asleep behind the wheel in the past month. And then we also asked if they have fallen asleep unintentionally off the job. And we found that 41% of our survey respondents had fallen asleep unintentionally off the job in the past month. So we know that the American workforce is being impacted by fatigue. They can see it in their impairment in their ability to think clearly, to perform well, and to literally stay asleep or stay awake at work and on the road. So we know this is a huge issue. So that was some high-level findings from our first report in the series, Causes and Consequences of Employee Fatigue. And again, you can find that at nsc.org/fatigue survey. Let's dig into the second report in our series, which is our Risky Employer Practices reports. And so this one releases data from our survey on our 504 employers about operational risk factors for fatigue and if they've ever experienced any safety critical incidents related to tired employees. So this report opens up to look at the impact that employers are feeling. We found that 90% of the employers that we surveyed reported being negatively impacted by fatigue in some way. So we know our employers are feeling the strain of having tired employees. And we'll break this down for you. If you're following along with your report, you can find it on page 5. But we found 47% of employers have experienced decreased productivity in their workforce due to fatigue or tired employees. Nearly 50% of employers have had an employee fall asleep on the job. 57% of employers report absenteeism due to fatigue, and this really can be costly if you have employees calling in sick because they're just too tired to come to work. And 32% of employers report injuries and near misses due to fatigue. And that last stat there is a huge concern for us. 32% of the employers that we surveyed reported having seen injuries or near misses in their workplaces due to tired employees. So let's look at some of those operational risk factors that we profiled in this second report. And we're really breaking them into two categories. We zeroed in on shift scheduling policies and practices as risk factors. And then we also looked at the fatigue safety culture within the workplace. So we looked at two types of shift scheduling practices that hold a bit more risk for fatigue than others, and that's the night shift and overtime. So as we saw in the introduction, fatigue as an impairment, our night shift workers are disproportionately affected by sleep loss and by circadian rhythm misalignment when they're on the night shift, and that's why we see more accidents and injuries occurring on our night shift. But also we see some risk in overtime or really long extended shifts. As we saw in the graph earlier, the longer the shift, the more the risk. So we asked about night shifts. We found that almost 50% of the employers that we surveyed are relying on night shifts as part of their operations. And as I said, night shifts hold inherent risk, especially for fatigue, but also an increased risk for accident and injury. So we asked about scheduling practices related to night shift. And so this table looks at 4 types of scheduling practices that can either increase fatigue risk or manage fatigue risk in the workplace. So the first one here, employees working a night shift immediately before or after a day shift holds a risk for fatigue. You really need to give your night shift workers that are transitioning on or off of the night shift, give them a day between that shift rotation so that they are able to get a night's sleep of restorative rest before they transition into a new schedule. And we found that only 50% of employers are padding those night shifts and giving them that opportunity for restorative rest. Our second one here, no predetermined end time for our night shifts. So one best practice is to make sure that your night shifts end at a predetermined time so that they're not stacking on long hours in addition to having that inherent risk of being a night shift. And we have 49% of the employers that we surveyed don't have a predetermined end time for their night shifts. So let's look at the practices that manage fatigue risk. Limiting the number of consecutive night shifts. 40% of the employers that we surveyed have a limit on the number of consecutive night shifts. And the last one here on our list is allowing naps or rest breaks during night shifts. This is a really great way to dissipate some fatigue that an employee might have accumulated during their shift, is to allow them to take a short nap. We found that only 13% of our employers that we surveyed that have night shifts are allowing them to take naps during their shifts. So let's look at overtime. 46% of the employers that we surveyed rely on overtime or extended hours, and as we saw in that graph earlier, the longer the hours, the longer the shift, the higher the risk. So this second report is really great in that we provided a lot of information on how to manage fatigue risk in the workplace through policies and practices, and also culture, which we'll talk about in a bit. So if you look on page 8 of your report, if you're following along, you can see the different suggestions or best practices to managing fatigue risk. For just general shift scheduling practices, forward rotating your shifts alongside the clock, day shift to afternoon shift to night shift is much easier on our circadian rhythm and adjusting to different shift schedules if you forward rotate as opposed to backwards. And then providing them at least 12 hours off between their shifts to really give them the opportunity to commute back and forth, to take care of family responsibilities, make sure they're eating well, and then prioritizing their 7 to 9 hours of sleep. If they have less than 12 hours of sleep, you might find that they're cutting sleep off of their to-do list in order to take care of other priorities that they have. Another best practice is to slowly rotate your shifts. For example, keep on 2 weeks on a shift before you rotate to the next one. Managing the risk of long hours. So again, we're talking about those quick shift returns. When you have employees that are working long hours, not only is their risk of fatigue increasing as the shift goes on, but also you're taking away their time after work in order to get restorative rest. So you really need to see kind of both sides of that. And then ways to manage the risk of night shift, provide opportunity for recovery rest when they're rotating off or on to a night shift. And really a full night's rest is optimal because again, our night shift workers don't sleep well during the day. So any opportunity they can have to get a night's rest is really optimal. Ending those night shifts as a predetermined times, which we talked about earlier. And limiting the number of consecutive night shifts to 4 nights in a row, and then providing them with opportunity to get some of that nighttime recovery rest. And then finally, we talked about the naps. A 30 to 40-minute nap opportunity for a night shift can really help decrease some of that fatigue burden. So we talked about our shift scheduling policies and practices, but the report also talks about fatigue and workplace safety culture as a way to manage fatigue risk in the workplace. So we asked employers what percentage of their workforce that they thought were at risk for fatigue. And we were really surprised to find that most employers, 74%, underestimated the prevalence of fatigue in their workforce. So if you remember our first report in this series, one of our first key findings was that 97% of the employees we surveyed reported at least one risk factor. So we know that a large proportion, if not all the workforce, has some sort of risk for fatigue. But when we asked employers if they felt their workforce was at risk, they thought it was closer to about 30%. So there is definitely a gap here between the effects of fatigue our employees are feeling and where our employers, if they feel it's impacting in the workplace. We also asked employers if they communicate about fatigue in the workplace. We recommend that employers talk to their employees about fatigue in the workplace, and this really comes down to setting an example for your employees, educating them about the causes of fatigue, about the consequences, teaching them tips for getting better sleep or motivating them to get better sleep, but also to make sure that your workforce understands that fatigue is an impairment in the workplace. So you really need to set that example by communicating with them that fatigue is an impairment versus really perpetuating a culture of employee burnout. So we found that 73% of the employers that we surveyed do not communicate with employees about fatigue. So there is obviously ample opportunity here for employers to really begin those discussions with their employees to really set that culture to see fatigue as a risk or as an impairment in the workplace. And so on page 9 of that report, we have some suggestions for how to manage fatigue through workplace safety culture. And the first is communicate about fatigue. Have an open dialogue as fatigue as a hazard in the workplace. again, discuss the importance of sleep health, getting better sleep, and getting screened for a sleep disorder, which we'll talk about a little bit later. 5-minute safety talks are a great way to do this. We talked about rest breaks a little bit earlier, and also educating on workplace fatigue and sleep health. So that was the second report in our series, Risky Employer Practices. Again, if you want to go download those, you can find them at nsc.org/fatigue survey. But now I want to share with you our third and final report in this series that we released just today, and that is Fatigue and Safety Critical Industries, Impact, Risks, and Recommendations. And so again, in this report, we did an industry by industry comparison to really see how the industries line up against each other. So what are some of the new pieces of data in this third report? One, we're comparing the results of our employer and our employee survey. So as you remember, our first report we released was just our employee data. Our second report was just the employer data. And now in this third report, we're really comparing the attitudes, beliefs, and behaviors of our employees versus those of our employers. So it's really exciting to kind of see both sides of the coin. But then also we're examining some of that industry data. So I'll share with you here our participants for the survey. So let me get out my pointer. So all industries refers to everybody that was in our survey, regardless of industry. So in our employee survey, we had about 2,010. In our employer survey, we had 504. And then in this third report, we are looking at 4 safety critical industries. We're looking at construction, manufacturing, transportation, and our utilities. And so you can see here the number of participants we had in both of the employee and the employer survey by industry. But I wanted to point out that this bottom row is looking at all industries combined, because it really gives us a great perspective of how these 4 safety critical industries kind of stack up against all industries. So let's look at some key results from this third report that we released today. And so when we look at the employee versus employer attitudes, one key result that we found that was while most employers see fatigue as a safety issue, we found that fewer employees saw it as a safety issue. And so if you look at our chart up here, you can see that nearly all of our employers that we surveyed believed fatigue was a safety issue, very high. It was all in the 93 to 100%, with transportation being the highest. All of those surveyed in transportation saw fatigue as a safety issue. But when we look at what our employees felt, while still high, they still felt it was a safety issue. It's interesting that employees were less likely to see it as a safety issue versus the employers. And so if we look at our highs and our lows here, our utility industry, the employees from our utility industry were least likely to see fatigue as a safety issue versus our employees from our manufacturing were most likely to see fatigue as a safety issue. But again, all of the employee responses were lower than our employer responses. So we here at the Council found that kind of interesting, and we were chatting a bit about why we thought that there was a difference here. And really, I invite you, if you have any ideas on why you think there is this discrepancy here, go ahead and type it in the chat box. I'd be really interested to hear other people's feedback. So we were kind of speculating that maybe this divide could be due to different levels of awareness of safety hazard. Maybe employers spend more time thinking about the safety hazard than our employees do. Maybe it has to do with overtime compensation. But if you are interested and you have any thoughts, go ahead and put those in the chat box. I'd love to hear them. But this really, we see this as really an opportunity for employers to educate their employees about fatigue as a hazard in the workplace, and really how it impairs our ability to think, to perform, and to be safe. So another key finding when we looked at employee versus employer attitude, while most employers believe it is unsafe to drive while tired, fewer employees agreed. So kind of the same gap that we saw in the safety issue we see here. So while nearly all of the employers surveyed see driving as being unsafe, they were all in the 90s percentile, manufacturing being the highest, but really not too much of a divide. Our employees, while still high, were lower than our employers, which again we found kind of interesting. So if we look at all industries that we surveyed, it was at 80%. So the overall average for the survey, 80% felt that it was unsafe to drive. It is interesting to see here that our 4 safety critical industries that we're profiling were all lower than the overall average, believing it was unsafe to drive while tired. Our utility industry, only 66% of those surveyed felt it was unsafe to drive while tired. Transportation was at 77. That's good to know that the large majority of those in our transportation industry felt it was unsafe to drive while tired. And our highest here was our construction industry. So another key finding, let's look at some of those industry comparisons a little more in depth. We found that most employees are tired regardless of what industry they're in. So overall, 69% of all of our survey respondents reported being tired at work. And our industries vary a bit. Our utilities industry, only 45% reported feeling tired at work. Versus our highest was our transportation. So our transportation folks are really feeling tired at work. Our construction, we're at 65%. Our manufacturing, we're at 63%. So another key finding from our industry comparisons, most employers feel the impact of fatigue, including productivity decreases and incidents due to tired employees. So if you're following along in the report, this table is on page 10. So this is looking at if the employers feel the impact of fatigue. We found that between 89 to 97% of employers feel the impact. So there is no doubt here that our employers are feeling the impact and the consequences of fatigue on their organization. Most of the safety critical industries were a little bit higher than the overall average of all the industries, which is kind of interesting, with the exception being manufacturing, which was just under. But 97% of those in the transportation industry are feeling the impact of fatigue on their organization. So if we break this down a little bit, looking at productivity decreases. Overall, all industries, 67% of all of those industries surveyed feeling the impact. And then you can see by our 4 safety critical industries, at the lowest we had utilities. They are least likely to report experiencing productivity decreases due to fatigue. And on the upper end of that scale, our manufacturing industries were more likely to report experiencing productivity decreases due to fatigue. So the final column here on this table reported employers had ever experienced safety critical incidents due to tired employees in the workplace. So overall, of all industries we surveyed, 32% had reported experiencing a safety critical incident in the workplace due to fatigue. And these are, again, the employer reported incidents. So I want to point out here that our 4 safety critical industries were all higher than the overall average. So on our lower end, the utilities were at 41% with the lowest of our 4, but this is not a huge spread here. And then our construction and our transportation were on the higher end. 45% of those in construction and transportation had experienced safety critical incidents in the workplace due to fatigue. So those were some of the findings from the impact of fatigue in the workplace from that 3rd report, but I want to shift over and talk about the risk factors that we looked at. And so this table looks a little bit different, but these are the same 9 risk factors that we looked at in our first report that we asked our employees about if they work shift work, if they have quick shift returns, if they're working long shifts, long weeks, high-risk hours, demanding job, if they're not getting enough sleep. And we really wanted to look at these risk factors broken down by industry to see if there were any industry by industry differences in risk factors. And so one finding from this was that safety-sensitive employees reported more risk factors for fatigue. And so you can see here, as we reported earlier, overall, from all of our survey respondents, 97% reported at least one risk factor for fatigue, while 80% reported more than one risk factor for fatigue. But when we look at our safety critical industries, their employees are reporting more risk factors for fatigue than industries overall. With our construction industry, every employee surveyed from our construction industry had at least one risk factor for fatigue. 92% of those employees from our construction industry had more than one risk factor for fatigue. And these are very high. Manufacturing, 98% had more than one or had one risk factor for fatigue. So these are all really concerning, again, to us, just to really see just how prevalent these fatigue risk factors are in our workplaces. So if you're interested in diving into the risk factors more, we have another detailed table on page 13 of that third report if you want to dive into that. But I'm going to shift over, and one thing that we featured in this third report was a case study from one of our member companies who is treating obstructive sleep apnea within their operations and doing so very successfully. So I wanted to share a little bit about what they are doing and some of the outcomes that they're finding. So Schneider Trucking is currently screening their employees for obstructive sleep apnea and then helping them get treatment. And so I have the steps here for you in our case study. So when an employee is hired, they conduct a screening survey to see if they are at risk for obstructive sleep apnea. And this is a survey that Schneider developed, I believe, with some sleep experts to really try to identify some of their drivers that may be at risk for obstructive sleep apnea. If they are flagged at risk, they are tested with a portable device. So this is really an interesting point here, because one thing I hear from employers is that there's a huge barrier to getting screened or tested for a sleep disorder because you have to go to a lab. You have to take a whole night off to go to a lab, and it's just a really big deal. But Schneider is actually using portable testing in their program, which really decreases some of those major barriers that employers and employees are experiencing to getting tested for obstructive sleep apnea. When the driver is tested, they get their results back from a sleep specialist the next day. So this is really, I think, important to note here that there isn't a huge gap between getting screened and getting tested and then getting your results back. They're trying to get them treatment as soon as possible. And that CPAP machine is prescribed within 24 hours. So there is really no delay to getting their drivers screened and then treated if they do screen positive. And one thing I want to point out here is that the CPAP equipment is covered by their health care plan. So there's no out-of-pocket expenses for their drivers to be screened, to be tested, and to be compliant with treatment. Schneider has made sure that they have overcome every barrier that could pop up to effectively implementing this program. And that is another huge barrier I hear from employees that talk about how expensive it is to get treated for a sleep disorder. So I want to share some of the outcomes Schneider's seen. They found that drivers with untreated obstructive sleep apnea had 5 times the crash risk as those that had obstructive sleep apnea but were complying with treatment. And so Schneider, actually, they had a team of researchers that came in and analyzed Schneider's program and their data completely separate from Schneider. Schneider didn't hire them, but they came in and really found these great outcomes. And so Schneider saw a huge cost savings in this, a cost savings of $400 a month per driver in terms of healthcare plan savings, increased retention of their drivers because of the program, reduced crash risk, and decreases in reportable crashes. So Schneider has seen great outcomes on their sleep health program. And if you're interested in how much fatigue may be costing your workplace, I want to use this opportunity, and we outline this a little bit in I think each of our reports. We talk about our fatigue cost calculator. One thing I tell employers is that fatigue is expensive, and a lot of those costs fall on the shoulders of employers, just as we saw from the last slide about Schneider. A single employee with a sleep problem costs an employer about $3,500 a year in lost productivity, absenteeism, and increased healthcare costs. So an employer with about 700 employees can expect to pay $1 million a year for those tired employees. So if you're interested in what that could look like in your workplace, you can find our fatigue cost calculator at nsc.org/tired-at-work. It's a free online tool. You enter in where your facilities are located, what industry or occupational group you employ, how many employees you have, and if you have any shift workers. And the calculator will give you a tailored estimate of how much fatigue is costing you in terms of decreased productivity, absenteeism, and increased healthcare costs. So for this example I have up right now, this was a smaller employer, and I'm sorry I don't remember exactly how many employees or what industry they were in, but their annual cost for this small employer was $228,000 just to sustain those tired employees. So there are great returns on investments for implementing these sleep health programs to really overcome some of these inherent risks of tired employees. So again, if you want to look and check out our fatigue cost calculator, nsc.org/tired-at-work. So the last few pages of our third report involve discussions on managing fatigue in the workplace. So through the second report and the third report, we really tried to put in some best practices on how employers could manage fatigue in the workplace. And so this third and final report talks just a little bit about fatigue risk management systems, which are policies, programs, practices, procedures that address fatigue risk in an already existing safety management system. So examples could include policies and practices on risky shifts. We talked a little bit about that earlier, about night shift practices or overtime practices. One component of a fatigue risk management system could be a sleep health program, just like we discussed with Schneider. Or another example would be collecting fatigue-related information in your incident reporting. So then you have a better idea of where your risk lies and where you can implement policies, programs, or some sort of countermeasure in order to reduce that risk. One exciting addition we had to this report was we wanted to talk a little bit about transportation and some other resources we have. So this is an infographic on driver alert systems, specifically drowsiness alert, that we have on our website, mycardoeswhat.org. And so driving alert systems are not a substitute for getting proper sleep. If employees are tired, we do not want them on the road. But systems such as this drowsiness alert can really help a driver be more aware of their own tiredness. So those were the high-level findings of all three of our reports. If you want to go download those survey series, you can find it at nsc.org/fatigue survey. But as I close out and before we open up Q&A, I wanted to share some other resources that we have available right now. If you are looking for any type of report, fact sheets, or posters, infographics, we have a ton of resources up on our website at nsc.org/fatigue kit. So go ahead and check those out. And finally, I am very excited to announce that this coming February 20th to the 21st, we are going to be holding a workplace fatigue conference. And we're really trying to bring some of our fatigue experts, our safety professionals, or our fatigue researchers together to really talk to some of our member companies or any other company that is really interested in addressing fatigue in their workplace. So if you think that you are interested in discussing fatigue further, Be on the lookout for our advertisements for our conference. Feel free to shoot me an email if you want to get on the distribution list for that. And we are holding the conference immediately after our Campbell Institute Symposium, which is the 19th through the 20th. And that might be something you all would be interested in as well. We will be releasing a fatigue report on a study that we've been doing about implementing fatigue risk management systems. So that's a really exciting report we have coming up that's going to be released at that symposium. And then we're also going to be having a fatigue panel at the symposium. So that is the end of my presentation, but we have about 15 minutes, I think, for Q&A. Shaylin, I'm going to hand it back over to you.
Thank you. If you would like to ask a question via the web presentation, just select the chat pod located in the lower left-hand corner of your screen. Then type your question in the box at the bottom and click Send. We have a bunch of questions waiting, so we'll get through as many of those as we can. A lot of people are asking if they can get slides of the presentation. Do you know any answer to that
that's
question?
not a problem. I can. I'm thinking of the best way to do this. If you want to shoot me an email, I can reply back to you with a PDF of the slide deck. Thank you.
Okay. All right. This person has an employee who has discussed his sleep issues. He sleeps an average of 4 to 6 hours of broken sleep, never gets a complete cycle of restful sleep. He's a shift worker from 6 p.m. to 6 a.m., drives 1 hour each way to the job site. Concerned about sleep medication being prescribed, so they would rather be sleep deprived as opposed to med side effects. They've already changed shifts, and that didn't seem to resolve any of the issues. Any suggestions?
Sure. So yeah, four hours of sleep and being on a shift does increase your risk for fatigue and fatigue-related incidents. We really want to see people getting at least 7 hours of sleep a day. You mentioned broken sleep, which is interesting. There are sleep researchers out there who are on both sides, that they believe sleep episodes should be consecutive. You should sleep 7 consecutive hours, and that's really probably optimal. But anybody that is on a shift work schedule might not be able to get 7 straight hours of sleep. And so really, if you could break those sleep cycles into 2 episodes, you're going to be better off trying to get that sleep. You also mentioned medication. So if an employee is suffering from a sleep disorder, either insomnia it sounds like, I would really suggest that they speak with their doctor about effective treatments and whether or not medication would be the best thing for them, given a longer commute and if they're possibly working on a safety-sensitive job. If you have any additional questions, you can feel free to follow up by shooting me an email. Thank you.
Okay, how many night shifts in a row is the norm?
Ooh, so the norm is a little bit of a difficult question, and I would not be able to tell you that. But best practices that we recommend is no more than 4 consecutive night shifts without enough break that gives that employee an opportunity for a full night's rest, not just a day off, but maybe even 48 hours off, so they can get at least 7 to 9 hours of night sleep. And again, that's because our night shift workers really struggle to get restorative rest during the day, and so they need those night rest opportunities to dissipate any of that fatigue and sleep deprivation that they might be experiencing.
Okay, was there ever a consideration to study the healthcare industry?
Yeah, so healthcare is talked about a lot when it comes to fatigue. You know, we have our nurses are on our night shifts, or I'm sorry, on typically work on shift rotations, so they are often one of the most highest risk group. There is a ton of research out there about the healthcare industry and about their fatigue, especially when it comes to say drowsy driving on their way home, or implications that that has with patient care and safety. That's not something that the National Safety Council has really touched on, just because that's not a huge reflection on our own membership, but we have been looking into emergency services and the effects of fatigue and then that shift work on say our EMS.
Okay, a lot of comments here. I'm getting down to the next question. Please repeat the site for the calculator.
It is nsc.org/tired-at-work. And I'll see if I can pull it up here for you all.
Okay, does the NSC intend to conduct a survey that will include stress as it pertains to fatigue?
Yeah, so that's very interesting. So we have been thinking and reflecting on fatigue as a component of wellness, and I really see that's where stress could fit in here. And so when I go and speak to employers, it almost feels like fatigue is kind of broken into two sections. It's either an operational issue or it's a wellness issue. And so this is a really great opportunity for me to plug some upcoming resources that we have. Right now we're working on creating a toolkit for employers. This would be a free set of resources that would be available for download on our website that would include things like model policies or practices, or materials for wellness programs to deal with sleep health and stress and other items like that. So that is something that we are very interested in doing, is creating those resources to help address fatigue from a stress and wellness perspective. And so that's something that we are currently working on and we hope to have available by next summer.
Could you put your email address slide back up?
Sure. And if anybody doesn't get their questions answered today, please shoot me an email. I love to hear experiences that our employers have, maybe barriers that they're running into or resources that they need in order to effectively manage fatigue in their workplaces. That is why I'm here. I'm here to provide resources and education for our employers. So it's really helpful for me to hear from you all, kind of your experiences and where you're at. So please do not hesitate to reach out to me with any additional questions or comments.
And I've had several people put their email address in the Q&A section here. If you could send that request directly to Emily, then you would be sure to get it better.
Sure.
Now, since the cell phone era has allowed employers to call workers out any time of the day or night, is there data that will be collected in the future on this? Like how many times people are called out? How does that affect your next work day, et cetera?
Yeah, so that's a really interesting point you bring up about these kind of call outs. We see that a lot in, say, like our utilities group, and it's something that we are trying to work on creating some best practices to address the fatigue risk that might introduce. So right now I don't have any recommendations or best practices, but that's definitely something that pops up a lot when I talk to our employers about fatigue in the workplace. And I think that's something that we will have to touch on in our toolkit that we are hoping to release next summer, is just some best practices to how to manage situations like that.
Will there be any sessions specifically about fatigue at the NSC conference in Houston?
There will. So I will be presenting twice in Houston. I believe on Tuesday afternoon, and then again on Wednesday morning at 10 a.m. So you should be able to find those pretty easily in the conference brochure, but if you want the exact times, feel free to shoot me an email and I can get those to you. One of the presentations will be about a study that we have conducted with our Campbell Institute, where we were studying the early implementation of fatigue risk management systems with a few of our Campbell companies to get some lessons learned from them. We will be sharing that, and then I will also be speaking at Congress about some of our survey findings.
Does the NSC intend to conduct a survey that will include stress as it pertains to fatigue? Did I already ask that question?
Yep, I think we already did that one.
As I read it, I thought, oh, I've already asked that. Okay, so you've convinced us of hazard of fatigue. How do we convince employees of the hazards and solutions?
That's a great question, actually. So I'd say that really the first thing to start to do is to just start communicating about fatigue as a hazard in the workplace, as an impairment in the workplace, and really kind of pay attention to your company's communication and just general safety culture. Are you promoting a culture of burnout, of employee burnout? Are you or are you promoting a culture where fatigue is seen as a hazard in the workplace? I'd say that step one is to really just start being better at communicating it, and that could be with safety talks even to start off with. You can find posters and fact sheets on our website that you could display around your workplace. But I'd say one of the first steps in launching a fatigue risk management system or in attempting to address fatigue at all is to really make sure that your employees understand that fatigue is an impairment and that you are wanting to address or correct this issue for their best interest, and that is to make sure that they get home safely.
Okay, what are your thoughts on nap rooms used in the chemical industry?
Yeah, so napping is a best practice for allowing employees, especially those on a night shift or a really long shift, maybe over 12 hours or maybe over 10 hours, honestly. But it's a really great best practice for them to dissipate some of that fatigue that they may have accumulated during their shift. So we recommend between 30 to 40-minute naps, somewhere maybe in the middle of a shift to help employees finish out their shift more safely. If they have a place to do that, would obviously be optimal somewhere where it's a little bit darker, a little bit more comfortable for them. I've heard of nap rooms that were outfitted with beds, with cots, or even with comfy recliners so that employees can just catch a quick nap during their shift.
Have you conducted any studies pertaining retail, since retail has become more of a target industry by regulatory entities?
We have not dug too far into the retail, but that is a really interesting industry to bring up. Our retail industry tends to work in unpredictable schedules. So they are shift workers, but they may not know the next upcoming pay period, what their shift could be. And because of that, it's really hard for our retail workers on those irregular shift schedules to kind of plan their life out and to really form good habits. And so we find that they do suffer from fatigue. Maybe they are on the night shift, maybe they aren't working really long hours, but just not having the predictability of knowing when your next shift schedule is going to be in the upcoming pay period can be really difficult for our retail workers.
How do you balance FMCSA, long work hours, with research findings?
Sure, that's a great question, and that's something that we have been doing some research in lately as some proposed changes to FMCSA hours of service regulations have popped up. I can't report out on that at this time since we are actively digging into the issue. But if you, I think it was Dorothy who asked, no, I'm sorry, David who asked that. David, if you want to shoot me an email, I'd love to hear your thoughts and share any thing I can with you.
Okay, I think we have finally whittled our way through all of the questions.
All right, thank you everybody. And I just want to say before you sign off, if you have any additional questions or comments or suggestions, feel free to shoot me an email. And also if you want a copy of my PowerPoint deck, I can send that over to you.
Okay, thank you very much. We want to thank everyone for joining in on this webinar today. We appreciate your attention and participation in today's event. To assist us in future events, please fill out the short survey that is going to pop up on your screen here in just a moment. No, it's not because I don't have an evaluation I can put up there. So I would assume it's going to be emailed to you. So you may now disconnect.